Welcome to Ask a Member, a weekly program of the Adrian Area Chamber of Commerce. I'm Ann Hughes, President of the Chamber, and with me today is Chris Dewey, who is the Executive Director of Lynwood Manor Skilled Nursing Facility here in Adrian.
Yes.
Welcome, Chris.
Thank you, Ann. It's a pleasure to be here.
Thank you. So, you know, there's such a, when somebody says, you know, you need to go to a nursing home, and there's such a tough perception.
It is. There's
among
a stigma.
families. How do you deal with that?
Well, sure. I think
or overcome it, I guess.
Sure. I think the first thing to understand is, what are your objectives when you're coming? Are you coming because of a medical condition that you need conditioning and therapy for? Are you coming for a long-term stay? Or do you not know what you're coming for, and we need to help you figure that out? Mm-hmm. So the skilled nursing facility of today is not what you may have remembered back from the 70s and the 80s of a nursing home, mm-hmm. per se. Nursing homes are a vibrant place where elders can recover, rehabilitate with the goal to go home, or if they are unable to return home and they stay, the goal is then to provide with them the highest quality of life as possible. So we offer a lot of activities, we offer therapies, we offer opportunities for residents and patients to socialize and interact, special holiday events for them to participate in, mm-hmm. so that even though they're not in their home, that they are feeling comfortable and that they're having a good experience. Okay.
So, you know, what's the process? I'm in the hospital. It's short term. I'm probably not going to have to stay there long.
Mm-hmm. So do your homework. Know what your options are. Always feel free to call any of the facilities or even tour those facilities before you get there, so that you have an idea of what to expect. We invite every family to come to tour. The process when you're in the hospital, typically you'll work with a discharge planner who's a social mm-hmm. worker or a nurse, and that particular person would be responsible for conversing with you about what your options are. Once you've made the decision of what facility you'd like to go to, you make sure the discharge planner knows that decision. Make sure that you are informed enough to make a good decision about where to go. When the plan then is made as to where you're going to go, then the discharge planner will work with the facility to facilitate that transfer. Mm-hmm. They'll help decide the day in conjunction with the doctor. They provide us with all the medication lists and all the instructions that the physician has for the patient, and then we pick up from that point on and make sure that you receive the medications and the care that the doctor prescribed for you. Mm-hmm. As far as personal items and those types of things, if you're coming in for rehab, just make sure that you're bringing in clothing that you're comfortable in, that you have a good pair of shoes that aren't going to slide on the floor, that you are bringing in things that make it your own space, even mm-hmm. though you're only there for a little while. If there's a favorite afghan that you have, or if there's, some residents have stuffed animals or trinkets sure. or photographs, all those things are more than welcome in the facility to make you feel at home mm-hmm. while you recover.
So what are the selling points? Why, when you're talking about Lynwood, why would I choose Lynwood over another facility?
Certainly. Well, at Lynwood Manor, we have a very competent staff, and we have just recently remodeled our short stay unit. The rooms are beautiful. We have a very large therapy area that has a lot of natural light to it. The whole walls on two sides of the gym are totally glass, so there's lots of great natural light in that room. New equipment, we have a SciFit bike, and we have parallel bars, a mat table, stair steps. We'll be getting our treadmill soon, so we'll have a treadmill for folks who have needs to improve their cardiovascular health mm-hmm. or are working on a joint that they're trying to get their joint back when they've had a total knee or a hip replacement. We have wonderful caring staff that will make sure that you have a very pleasant stay while you're there, and they're very competent in treatments and care of residents. We have a certified wound nurse who's on staff. We also work very closely with many of the local physicians in the county to ensure that their patients transition from the hospital to the skilled setting and then to home. We work with the home health care agencies to ensure that patients have a good transfer from our facility to their homes. And we also work with several hospice agencies in the event that a patient is not doing so well and they need that extra support of a hospice service. We can also facilitate a hospice intervention for that patient, and they can remain with us until such time as their services are no longer needed. Okay. So at Lynwood, we are under new ownership, we're under new management. The facility rooms are beautiful, and we really do work hard to ensure that our residents have a very positive experience because we don't want them to have the fear of the nursing home. Right. And we also work to ensure that when they leave the facility that they have the resources and the information that they need to have a successful transition home.
Okay. Yeah, in fact, I was just at your facility visiting a friend yesterday and walked through the rehab unit and totally remodeled.
Yes.
Almost looks like, it reminds me of dorm rooms with the new built-in cabinets and closets and counter space and that. Are there plans to do further remodeling in the regular patient rooms, the long-term rooms?
Yes, we are planning to continue the process. We're looking at a phase 2 and probably a phase 3 at a point, hopefully in the near future. We'll be able to start phase 2, but no construction date has been set as of yet. So, but we do anticipate going through and doing the rest of the facility. Right now, the rehab section is 20 beds, which is short stay patients. When we get ready to do the remaining 64, it'll be remodeled. It probably won't look exactly like the rehab section because for patients who live with us full time, we want them to be able to bring their own personality to their space. So if they have, we have residents who bring in their lift chairs or their special recliner, they bring in a special dresser or a special china cabinet, those types of things. So when we do complete the rest of the building, it will be similar in design, but it will probably have furnishings that are more aesthetic for those who are coming to stay with us.
To stay, okay. What's your occupancy rate run?
We are an 84-bed facility, and we in 2012 we ran 85% occupied for the year.
Is that good? Is that good according to the national average?
Yeah, the threshold they like to see us at is 85% occupied. Okay. Of course, we'd love to be 100% occupied.
Sure, yeah.
We'd love to have everyone come stay at Lynwood.
But it's nice when people need you that there's a couple rooms left for them.
Absolutely. So anytime family may be considering long-term care or considering rehabilitative stay, even if you know that you're going to have a surgery in 30 days or 45 days, you can always call the facility, plan ahead, come in, get a tour, see what we have to offer, and then we can start working with you on your discharge plan from the hospital before you even go to the hospital.
It's probably less traumatic
Absolutely.
doing it than when you're in good health. And
I think the challenge for most families is they're thrown into a situation that they weren't expecting of mom or dad has to go to the nursing home. And then there's that panic of, oh my goodness, now what do we do? If you know you're going to have a surgery and there's the potential to have to go to a rehabilitative space, it's always best to kind of do your homework before. Right. And that way it's not as traumatic at the time of discharge from the hospital.
Sure. Now, I'm certain that Lynwood is accredited. All nursing homes have to be accredited.
We are state licensed.
Okay.
Yes, we are state licensed, and we are a member of the American Healthcare Association and the Michigan Healthcare Association.
Okay. What's the best thing Lynwood's got going for its residents?
The best thing Lynwood has going has to be the staff. The staff at Lynwood truly cares about the residents that they serve. They will work very hard to make sure that the residents feel as though they're part of the family. You know, trying to pay attention to every detail for a resident, ensuring that we know what their likes and their dislikes are. I have stories from families of, you know, CNAs who will sit and hold mom's hand because she's having a bad night. That's not in their job description, but they do it anyway. Ensuring that if a resident doesn't like broccoli, that we try not to put broccoli on their plate for dinner. Mealtime seems to be a very important thing
Oh,
for
sure.
folks.
I can see where it'd be the highlight of the day.
Absolutely. So trying to make sure that if they like chocolate ice cream, that we put chocolate ice cream on that tray. Ensuring that their clothing gets back to their rooms. You know, occasionally things don't always go the way we hope, but you know, the staff really do take pride in what they do. They feel a sense of pride about the care they give to their residents, and I think it shows in the relationships that the staff have with the people that they care for.
Okay, very good. If people want to get hold of you, if they want to stop in for a tour, tell us where you're located and what your phone number is and website.
Great. Well, we're at 730 Camole Lane, right across from Bixby Medical Center. Our phone number is 517-263-6771. You can contact myself, Chris Dewey, or the admissions department to schedule a tour or to just talk to us about a potential admission. I'd also like to mention as well that we are the only VA contracted facility in Lenawee County. So for
that's important.
Residents in the community who may have veterans benefits, please give us a call. We can help you walk through that process of getting a qualified veteran stay for the facility.
And what's your website, Chris?
Our website is www.lynwoodmanor.com. And please don't get discouraged. We're getting a new website.
Okay.
The new owners are finishing the final touches should be together, and we should have a brand new designed website up in the next week or so.
And we'll let everybody know when it's ready.
Absolutely.
Okay. Thanks, Chris.
Thank you, Ann.
Take care.
You too.